Hello, everybody. My name is Greg Rabarczyk, Associate Professor of Geography at the University of Michigan Flint. I'm also the leader of the research cluster on urban sustainability and environmental health. And today I'd like to welcome our second speaker in our winter semester seminar series. First, I wanted to give a glowing introduction to our speaker, who I've known for a couple of years now. He was highly recommended to me from a good friend of mine who works at the city of Detroit doing GIS. Alex Hill wears many hats. He describes himself as an anthropologist, cartographer, information designer, communication strategist, and my favorite adjective or description is data nerd, which is also what I describe myself as to my parents, to their puzzlement each and every time. So Alex has published extensively on the areas of food security, racial politics, public discourse, child health care in Detroit, air quality assessments. And what I like the most is that he is focused on Flint as well. But most of his research is done in Detroit at Wayne State University. He's vested in food access, health equity, and racial justice. He has more than 12 years experience working with nonprofit organizations on campaigns impacting policies and communities. Other accomplishments of Mr. Hill is that he has created the Detroit Food Map in 2011. He founded Detroitography in 2013. And he recently published a book that I need to purchase immediately for my coffee table entitled Detroit in 50 Maps, which has recently been voted as one of the best books of 2021 by the New York Times. Currently, Alex is a PhD student in the anthropology program at Wayne State University. He is also the GIS director in the Biostatistical Epidemiology Research Design Group at the Center for Translational Science and Clinical Research Innovation at Wayne State University, of course. So help me in welcoming virtually Alex Hill to our second speaker in our seminar series at the University of Michigan Flint. Thanks, Alex. Take it away.
Excellent. Thank you so much. And it's so great to be here. Greg also joined us for GIS Day and gave an excellent talk. It was a great part of the many presenters we had. And I am originally from the Flint area. So a lot of my aunts, uncles, and grandparents are still in Flint. I'm very familiar with the U of M Flint campus. So it feels like home to me. Even though we're not there. And you'll have to forgive me for my DIY projects that you can see behind me. During the pandemic, we all, I think, came up with interesting ways to make our home spaces livable, and I just moved a little more slowly. So I'm gonna share here. So I'm primarily going to talk about a lot of my work in food and food access, and also just note that I'm no longer full-time at Wayne State University as their GIS director. I'm now the statewide research director for a group called We the People Michigan that's working on building a multiracial coalition of folks that are working on bringing about justice and equity across the state. I do still coordinate the geospatial at Wayne group, where we're doing a lot of the GIS education and learning. So they were doing a lot with standardizing curriculum and offering opportunities for students. And a big part is, having class projects not just be submitted at the end of the year for your class, but, how can you get it out there? I don't know if blogs are too millennial of a thing, but it's a really great way to get your information out on the internet. And honestly, that's what has landed me a few jobs, is just throwing maps up on the internet on Detroitography. Well, not just throwing them up, obviously with a lot of thought and planning and good design. So I do also teach in the departments of urban studies and planning and the new Department of Public Health at Wayne State. So I teach intro to GIS and also teach a course called Public Health in the City, which Flint features strongly in one of those one of those weekly modules that we have there. And then the Detroit Food Map Initiative, which, that really started when I moved to Detroit. That was over 10 years ago now, 2009. I moved to the city to be a community health worker. I had, not a lot, being from the Flint area mostly, I was driving down I-75 to go to a Tigers game at the old Tiger Stadium or go to Cobo Hall for the dog show or something. But that was about it. And so, I first went to data and maps to better understand Detroit and where I was and what I was experiencing. And I have to say, it was probably data and maps were helpful, but even more helpful was that I was a community health worker and I was going into Detroit families' homes. I was going to 2 to 3 families' homes every single day, 5 days a week, on weekdays, weekends, evenings, mornings. And that gave me a really great perspective on the city that I just landing in the city and not knowing anything, I wouldn't have gotten anywhere else. So very thankful for all the families in Detroit that welcomed me into their homes. I always get ahead of my slides, but this is just going to talk about how I'm involved in a lot of different things around data and maps in the city. I do, because of the pandemic, I haven't done as much kind of community workshops and trainings, but Map Time Detroit, we've tried to do a few virtual events like that. The goal there is democratizing map making. So introducing people to GIS skills and where to find data sources, that kind of thing. And then I also used to teach a 4-week course for community members. We call it Data Mapping and Research Justice. And so since 2014, about 100 community members, and I'll say local students, have also gone through the course. But about 100 folks have gone through that course and are currently using those data and mapping skills with small organizations and nonprofits in the city. I always kind of, I feel like I have to have this slide about terms because there are so many terms in the kind of food space, and what the heck do you mean when you say a food system or food security or a food desert? So I always just throw these up as a kind of helpful grounding place to start. I guess folks can read them, but really food system, I think everyone has a pretty clear understanding of. Sometimes I think we don't think broadly enough about the food system and all the different workers and labor aspects that go into it. Food security is one where I find a lot of folks, it's just kind of a broad catch-all term. And so I think this one is actually from the World Health Organization. So folks having consistent access to nutritious and culturally appropriate foods to maintain an active and healthy life, which that part at the end I think is really critical, that often gets looked over. And then food desert, I'll be talking about Detroit. You all probably have heard this term too often as well, being in Flint. Folks in Detroit don't want to hear it anymore. I did a bunch of qualitative interviews asking folks who are leading organizations in the Detroit food system, what do you think of this term? Has it been helpful for your work over the years? How has that changed? Because it was really big with the 2008 Farm Bill. And there was actually a coalition from Detroit that, they lobbied Senator Stabenow really hard to get that term into the bill. And then now they regret it. They said it was really helpful at that time to get a lot of funding. But since then, everyone has just been confused and it's been really unhelpful. It's just been a negative metaphor that's kind of hung over the city when there are a lot of grocery stores. There is a lot of food. Anyway. I also think, helpful to ground kind of discussions in food access in thinking about, both food security and then that food desert term. But 16% of Detroit adults are reported that they eat 5 or more fruits or vegetables a day. Now, I don't know. I don't even know if I eat 5 fruits and vegetables a day, or I should say 5 servings of fruits and vegetables. Um, I actually think since having two young children under the age of 5, I've increased my fruit intake. So that's one good thing. But then thinking broadly about this access question, we have 1,200 SNAP retailers in the city where, supposedly you could buy food. I know in many of those locations, there is not really food to buy. And they probably shouldn't have that SNAP distinction anymore. But we also know that regulation and kind of inspection maintenance doesn't happen in these types of locations. So when we're pulling data to look at what food access looks like or where food might be, a lot of times the data is just out of date. It's no longer relevant. It's going to take a lot of ground truthing to be able to understand what's actually happening. And so this is kind of what that access map, just looking geographically, is in Detroit. We have, unfortunately, in the last 10 years, it's been about we've lost about 1 full line grocery store every year over the last 10 years. So when I started the Detroit Food Map Initiative, we were surveying, we had a list of 84 stores. The list we ended up with was actually 74 stores because a bunch of them were closed or they were just small corner stores. And today we're closer to around like 64 stores. So unfortunately, that access picture keeps shrinking in very specific areas of the city. So this map is actually when we had 74 stores. You can see, that USDA 1 mile buffer covers pretty much the whole city. But we know food access isn't just about geography. You can also see here where that kind of disconnect with data is, where we went and ground truthed all these grocery stores, but the USDA, they were 2 years behind. They had defined all these areas as still being food deserts. I think notably, on Grand River, there's this store that had opened. I don't think that's the new Meyer store. Anyway, and then there was a store that reopened kind of along East Jefferson Avenue on the city's east side that wasn't captured in the USDA data at all. And obviously the pandemic had pretty significant impacts. We saw a handful of stores close. So some of these have reopened now, but a handful of them, well, actually this one has remained closed. It's no longer a store at all. I think these other 2 have reopened since then. But then there was this interesting geography of, where you could do curbside pickup, which was mostly in this downtown along the river area. It's also oddly like Gleaners was doing their grocery pickups with the city of Detroit, and most of those were happening kind of in this downtown area as well. They had one site. And then there was a nice sprinkling of stores that said they were going to do specific senior hours to get that access for elderly folks to do safe grocery shopping. And we saw a whole bunch of stores kind of flip their model, and they started putting up metal shelves in their, where people usually sat and drank coffee or something, and started carrying dry goods and different grocery items that folks might need in the neighborhood. But again, there was this interesting geography of, most of that was happening in Detroit. People call it the greater downtown, or the 7.2 square miles, which is kind of where that conflict happens between what people say is downtown versus the neighborhoods. So we very much saw that playing out in food access during the pandemic. The other big effort that I work on in Detroit with the Detroit Food Policy Council is we do a Detroit food metrics report every year, which a lot of that kind of grew out of the Detroit Food Map Initiative and the data we were collecting from grocery stores. Um, but we really wanted to take a quick snapshot of, what does Detroit's food system look like? Who's there? What are they doing? How are they connected? And we had this huge kind of startup incubator, folks trying to launch a restaurant or a catering business, or in some cases a community coffee shop. And they were very connected. Food Lab Detroit is probably one of the best known and the biggest food business incubators in, I don't know, in the country maybe, but definitely in Detroit. I know they've just launched an Australian offshoot in Sydney. Anyway, and then we also saw, the food security, emergency food space was very connected, had a lot of folks involved. But then these kind of two huge segments of the food system were only minimally connected to folks who were working on food access. A handful of those folks were connected through like the Detroit Community Markets Hub. There really was just like these green sprinkles of people actually producing food to go into the food system. And then health in the food system was really just on the edges. Sometimes people did it, sometimes they didn't. Sometimes the people were working with the health department, sometimes they weren't. Which I'm also the former program manager for chronic disease and injury prevention at the Detroit Health Department. And it was always a struggle to find where these partners were and how we could best work together. This is just my fun graphic for food system, as we've already defined it. We include this in our food metrics report every year, making sure to note all of the kind of broader external systems that impact a healthy food system. And as we've tracked over the years, so here you see the full-line grocery stores have continued declining. We don't necessarily expect that to go up. The Detroit Black Community Food Security Network is going to open their Detroit Food Commons, which is going to be a Detroit or a food cooperative. But I don't know if they broke ground or if they didn't yet. Anyway, it'll be a while before their construction is finished and they're actually open. Other things we look at is like the grocery square footage per resident and what's available, and that also, obviously with grocery stores dropping, that number is also dropping in coverage. Even though we've had 2 Meijer stores open over 200,000 square feet, that still doesn't sway that number too much. The other thing we've seen is farmers markets and farm stands have also continued to decrease. During the pandemic, there were a handful of new farmers markets that launched, but those didn't make up for the markets that kind of closed down or stopped operating. And probably the biggest pandemic impact is Detroit growers weren't really able to go to the market and sell their stuff. A lot of folks who are actually in the production business hoping to make money, restaurants were closed during the pandemic. So they had absolutely no customers. So a lot of those producers were setting up tables at the corner where they were growing food in their neighborhood to try to either give away the produce or sell some of it. It was a tough time. But I know part of that, they also launched, now I can't remember what it's called. I think it's Shop Detroit Farms. And that was trying to create an online platform for Detroit producers so that they could continue to make money and stay in business. I'm going to skim over food waste and jump into this Detroit Food Map Initiative. So we started with our pilot in 2011, just doing 30 stores using the Nutrition Environment Measures Survey. We had to do some adaptations for Detroit. One of the categories was frozen meals, and that's really just kind of a wild food category. Really figuring out what's important there was tough. But so we ground truth 76 full line grocery stores in 2013 and did every single grocery store in the city. So that's where we found, a lot of stores had closed. Some were just convenience. A lot of them were starting to convert to Family Dollar or other dollar store type locations. And we also included Highland Park and Hamtramck because they're two small cities encompassed by the city of Detroit. So you can't really talk about access without covering those. In 2013, we were able to put that scoring from that NEMS survey up against a study of children experiencing obesity. And we found that, our question was, is it access to fruits and vegetables? Is it distance? Is it family income? What might it be? So all these participants had at least one full-line grocery store that carried fruits and vegetables within access of their home. But the only thing that was positively correlated was family income. And I don't think that's like rocket science or groundbreaking, but but very often in the kind of built environment food access space, people are like, well, proximity is what matters. But then I work with a low-income family who they drive 30 miles every week to spend their limited budget at Meijer in Livonia instead of shopping somewhere close by that it has the food, but there's a lot of other factors. So we've done citywide surveys. So we've pretty much tried to focus every other year, 2013, 2015, 2017. 2019 got a little messy, but we did the whole city again in 2021, as well as the kind of surrounding and suburban area and Flint. So our survey team worked in Detroit, Warren, and Flint in our last round of surveys. And I previously worked with Dr. Rick Sadler to do the Flint food store survey. I think it was 2016. And then we've also done this in Battle Creek, and currently working with an RWJF project in 7 cities where we're kind of testing out this grocery survey tool and what we can do with it. As an anthropologist, it was really important to me to not just understand, where was their food and how much was it available, but also what were people's perceptions of their own access to food. And so that was a whole series of focus groups and individual interviews. And, we kind of got to this place where people would talk about kind of, quote unquote, good and bad stores, where they would prefer shopping or not prefer shopping. A lot of times those bad stores were in their neighborhood, not exclusively, I'll say. There were plenty of good stores in the city of Detroit, but more often than not, folks preferred to drive outside of the city, where they felt they had a better experience, where they didn't face any discrimination or racism or bad customer service was kind of a key factor there. And so that really changed. What does food access look like in Detroit? Well, you have to drop the city limits when you're thinking about that. How am I doing on time? I think I just have a handful of maps.
Let's see them all. Looks good.
So we've got here, just looking at food retailers, from all of those qualitative interviews, we asked folks where you most often prefer to shop. So grocery store was number one. Number two is convenience store, so like a Rite Aid or a Walgreens or a CVS. And then dollar stores were actually number three on the list where people would shop for food. And very often they talked about pairing their shopping. So they would go to where the full line grocery store was, and then they'd pop over to the dollar store across the street to get their canned goods for $1 or that kind of thing. Or they needed to pick up cleaning supplies, and the grocery store cleaning supplies are really marked up. So you go to the dollar store and get your cleaning supplies. And so that was very often a tactic that was used. And that was something we had run, it was called Senior Market Days, where it was a group of churches and they would purchase like a school bus and pick everybody up at a church. And then they'd go to the grocery store, go to Eastern Market, and go to a dollar store. And that was, the organizers had no idea that was going to be a request to go to the dollar store. But that's what people wanted. They were like, no, I got to get all these other things, and I'm not going to buy those at the grocery store because they're in the business of food, and everything else is, just priced beyond what I'll pay. And so in Detroit, we've really seen this shift. I think this is really happening across the country, that this dollar store shift is happening and really kind of taking up. In Detroit, we saw these, so they're small footprint, full line grocery stores, but they're turning into dollar stores. Or in the city, I don't think there's any Rite Aid. I think there's one Rite Aid, and it's by the university in Midtown. All the other Rite Aid stores have closed, and Family Dollar has figured out how to reskin them so they don't look like a Rite Aid, but they have the Family Dollar orange and red scheme going on. And they've done that to every Rite Aid in the city. In the same way that they've figured out how they can buy a CVS and again kind of reskin the outside so it has the Family Dollar branding. And so that's where we've seen kind of dollar stores are skyrocketing while grocery stores are dropping. And so as I noted, a bunch of these convenience stores are getting out of town as well. I don't think there's any Walgreens stores left in the city. I think there's just one Rite Aid. And CVS has really kind of limited the number of stores that they have. So it's interesting to see that kind of shift where convenience stores thought they were going to be successful. So this is what farmers markets and farm stands looked like across the city before we saw a lot of shifting. This Fresh Corner Cafe group, they closed their doors, so all those pop-up sites no longer exist. Most of these Detroit community markets are still operating. Oh no, a handful of them are not. But I would expect some of them would start up. And then, so the East Side hasn't had a dedicated farmers market in a really long time, but thankfully they have one that started. There's a Jefferson Chalmers farmers market now. There's a farmers market up in Palmer Park. District 3 is still lacking a farmers market, but we'll work on that. The other things that often come up in talking about this food access space, emergency food obviously is a big one. It's one of the largest sectors. I should have color coded these based on when they're open. When you look at the list, the schedules that all these sites have, it's basically like Wednesdays from noon to 2 when they're all open and they all are distributing food. And then every other day is hit or miss, or it's really wild that all the schedules align on like one day in the week. So then you really have to question, what is emergency food bringing to the food access space if it's really, 2 hours during the middle of the day, 1 day a week. Anyway, the other area where there's been actually some movement, kind of talking about policy, is WIC stores in the city. So you can see here, it's the stat is that basically 50% of stores that are certified to accept WIC vouchers are liquor stores. And the state makes the argument that this is because of food access. And, thankfully, pretty much every grocery store in the city is an approved WIC vendor. But then, you can imagine there's a handful of other sites that might be better as a WIC approved vendor. Even a dollar store would probably be better, because we've done our surveying inside of liquor stores as well. And there's really, besides the fact that when we did our qualitative interviews, the perception that folks have of liquor stores is, usually involves swearing and saying that there's no way they're ever going to step foot in there to get food for their kids, or, it's not just because it's there doesn't mean people, again, that's that proximity problem. Perception is way more important. The other thing we've seen a really big shift on in looking at kind of the food access space in Detroit is summer food. So the United Way kind of created the model for Meet Up and Eat Up, that's now adopted by the State Department of Education. And in Detroit, Gleaners Community Food Bank is a huge partner and runs a lot of these sites. But the City of Detroit Parks and Rec Department also, they used to run, I think, half of the sites, but they've not run their program as well as they should have. So they've lost, I think, before the pandemic, the federal and state program managers made them reduce. They were at like 250 sites. And they said, look, you have to be able to do your 12 rec centers really well before you can expand it all. So that was a major change. I think that was just 2019, and then the world changed. But that's something big to look at in future years as it goes. Much like Flint, Detroit has a significant urban agriculture community and folks that are. This is only community gardens, so this doesn't include all of the backyard gardens. I'm not about to put people's backyards on a map. And the idea here is, again, thinking about what does access look like. Is this a community garden you could go to and you could join and you could get some fresh produce. The problem here is that it's really hard to tell which of these sites are active and which are not. So last, or I can never remember what year it is anymore. And I always say about 6 months ago, because I just have no concept of time anymore. I think it was last year. Last year, we had a handful of students who used the Google Street View timeline function to look at some of these community garden sites and if they've been active, if they've stayed active. And from this snapshot here, about 50% of the sites are no longer active. So they're just kind of garden beds with weeds. And I know community gardening is cyclical, and a big part of community gardening is the community. And very early in Detroit, well, I shouldn't say early. In 2014, there was a huge push among a lot of different foundations and grant makers to support urban agriculture and to set up these sites. And so it's just like dumping money and going gangbusters. And so I guess it's that proximity problem again. They set it up and they thought people would come, but they didn't build the community, and they didn't bring the community on board with a lot of these sites. We've also focused on what does this kind of regional equity look like. So we have all of these, quote unquote producers in Detroit. Most of these large scale farming operations are less than an acre, which is, in the farming business, that's just like nothing. I think a small, well, I don't even know. I think a small farm is like 200 acres minimum. And that's even like really, really small. Um, and so we see kind of this disparity in who's coming to Eastern Market. So not surprisingly, the very rural northern half of Macomb County, and then pretty much all of Monroe County is rural. I don't think any part of it you could say is urban. Maybe, I don't know. But so that's where we see most of our producers coming from to Eastern Market. And that's one, we see a lot of that food coming from these far out areas into Detroit, and then from Detroit they go to the more wealthy suburbs around the city, as opposed to staying in Detroit. So creating disparities on various levels, but then we also have this kind of major influx of predominantly white and more conservative farmers into Detroit, a majority Black African American city, and that's caused some tensions at the market as well. And that's so talking about the disparity. The USDA tracks these numbers, and when it all breaks down, the numbers aren't even trackable in Oakland and Macomb County. So really, this number is just for Wayne County, where 7% of farm acres are held by Black farmers. And most of those are in Detroit, or I'm trying to think. I think Inkster was the other area where there's actually acreage owned, held by Black farmers. And so we've seen efforts in the city to kind of bolster that. There's the Black Farmer Land Fund, run by a handful of partners in kind of a coalition in the city. So all these green dots are folks who have been awarded funds to secure land and become Black farmers in Detroit's food system. And then, thinking about, this city of Detroit has no Black-owned grocery stores. There's one, it's a very small footprint store concept that's starting up called Neighborhood Grocery. They actually, they're also a recipient of a Black Farmer Land Fund. So they're trying to grow food and then also carry it in their store. And then the Detroit People's Food Co-op from the Detroit Black Community Food Security Network is going to be up here, kind of in the middle of this North End area that we would say Detroit. The last map I have is just looking at what does this grocery purchasing look like. I should have moved this up when I was talking about people will drive 30 miles outside of the city to stretch their food budget and make it work. But so areas in orange are where there's more leakage, people traveling more to spend outside of their neighborhood, and green where there's more spending within. So a lot of opportunity for grocery, but we still see the number of grocery stores dropping every single year. So I think I see a question in the Q&A. Can you explain the ground truth process? So for us, that was, well, first it was narrowing down where the heck do we get the list. So we worked with the Detroit Economic Growth Corporation, who was running, they called it a green grocer project. The primary goal there was just facade improvement, so making it look nice on the outside, which is important for perceptions and actually people entering the store. But so we traveled to every grocery store and went inside them, and that was our ground truth process. So from that, we actually developed a Google Street View assessment criteria for identifying, quote unquote, full line grocery stores as opposed to other types of stores. Because that's what the majority of the public health literature aligns with. A full line grocery store in a neighborhood is what has the greatest positive impact. So in later years, we we utilize that Google Street View method in like Flint and Battle Creek before setting folks out. And then when we do the ground truth is when we do the nutrition environment measures survey, or I guess the adapted version of that. And that looks at both, outside and inside conditions of the store, signage on the store, and then there's 10 kind of broad categories of food that it looks at comparing and looking for healthful food items versus less healthful. So, in like a cereal category, it'd be looking at what is the non-sugar version pricing and availability look like compared to the high sugar version.
Alex, there's also a question in the chat that says, what are opportunities here?
Yeah, what is the...
Alex, I think you had a slide early in the presentation and you defined opportunities, or didn't define opportunities, but I think it was earlier in the presentation.
Yeah, and I'm going to unmute the person that asked the question, that wants to ask the question, and he can sort of speak more to it as well. All right, Jacob.
Oh, the network analysis.
Yeah, that was it. I think it was the slide that was kind of a network analysis. I was just curious what the red dots were that were labeled opportunities.
Oh, yeah. Sorry, that's our Detroit Food Metrics report. We broke it down into kind of these different sections. And so food opportunities with food was one. So that's like food business, making money with food. That's what opportunity means.
Got it. Thank you.
Yeah. So I don't know if folks know all these different groups. Food Lab Detroit is an incubator. They do workshops on starting a food business. They have a whole series that you can go through. They also, I had a table that kind of broke down. Well, anyway, Food Lab, out of all the different things, offers everything you need to launch your food business, where some of these just offer bits and pieces. The Build Institute is also a Detroit specific entity focused on kind of entrepreneurship. And so they have like a 6 to 8 week series on how to, create your business plan, and they walk you through a whole bunch of steps and training. The NEI Ideas is the New Economy Initiative. That might also just be in Detroit. That was looking at who they funded that is a food business. And then a lot of folks kind of on the really early stages of food business use this site called IOBI, which is a crowdfunding kind of platform. So a lot of folks who are maybe doing a food catering business that want to get a food truck, they'll do some crowdfunding there to get started.
And another question just came in through the Q&A, Alex.
Oh, yes. Yeah. Vehicle ownership and transit are fun constants in Detroit. We did ask folks, how they get to food, what methods they use, and everyone used a car. They had a car, they borrowed a car, they carpooled with their neighbor, or they used, like a ride sharing something. So it was always a car that went with them to the grocery store. There's only a handful of instances where, as a elderly man who lived across the street from Dollar General and he only ate canned soup every day, so he walked. But that was about it. Generally, people don't talk about using mass transit at all for grocery pickup. They don't talk about riding their bike and picking up groceries at all. And walking is really, like, unless you really live right by that store, So like I know there were also a handful of folks who walked. So in Lafayette Park, which is there's a park there, but it's also it's a high-rise apartment complex, and there's a grocery store that's kind of right adjacent to that. So you can walk through the park down to the grocery store, and a number of folks do that.
Alex, I have a question.
Yeah.
Excellent talk. I loved it. So I've done a bit of research on food access by way of University of Michigan. We did a statewide analysis, and we also saw, especially in Grand Rapids, how disenfranchised neighborhoods or people living in them would drive to the burbs to go find excellent food outlets. So I don't think we studied that directly, but what's your gut take on why people are going to such great lengths to find better food outlets, healthier food, the Whole Foods, or places that that are not in their neighborhood? So yeah, I don't know if you have any data that addresses that, but I found that very curious as well.
Yeah, I mean, the biggest thing that we found on preference in where people shop is really how they're treated. So people want to shop where they're treated well. And that was, across the board, whether they were choosing to shop in a suburban chain store or their neighborhood grocer, or, even a lot of the projects now that are trying to start up Black-owned grocery stores. It's largely because of the way folks are treated when they interact in the food system. In-store treatment and discrimination was number one, and a close second was pricing. And that's a really hard game to play if you're a grocer in kind of a low income setting. I know there's a handful of suppliers that, they say they won't even drive into Detroit. They won't stop their trucks in Detroit. And that's, it's some coded racism of its own when your suppliers won't even enter your city. But then, as a grocer, when you're trying to stock those things on your shelves, certain products might end up being, $2-3 over what they might be at Meijer, because you can only get so many and get them on your shelf. And that's a big reason why you see the things like cleaning supplies are really marked up at the grocery stores, but folks prefer to go to the dollar store. Also in the research, it was really interesting that I don't know that anyone only shops at one location for their food, but that was something that we hadn't really thought about too much before then. The idea is your full line grocery store, you can go in and get everything you need. But at a minimum, folks said that they were shopping at 3 different locations throughout the week for their food, or I'm sorry, in the month for their foods.
Alex, I guess I had a question, which is, so you talked about community gardens and sort of they're cyclical and they're sort of on the decline. A lot of what you had on the map is just weedy now. What about like community supported agriculture, like maybe not at a market, like where people would have to go and pick up these things? Did you talk about that, or do you know anything about that in the city of Detroit?
Yeah, there are a few CSA options. There's a kind of a cooperative group of when they started, it was 7 local growers. It might be more now, but it's City Commons, and so they offered a CSA that you can pick up on a monthly basis, and they used to do their pickup at Eastern Market. I don't know what they did during the pandemic. But there's really not very many of those. and so that shop, it's Shop Detroit Farms. Now I don't know what it's called. But that was the idea with starting that site, was that it was a sort of a CSA without having to, oh yeah, Shop Detroit Farms. So they could get more people into, oh, and this is a different group actually of producers. But yeah, so that's and I know there's also the, so Keep Growing Detroit is the largest urban agriculture supporting organization that very much grew out of the Farm-A-Lot program through the rec department. So when the city was like, nah, I don't think we're going to really continue making this program happen, the Greening of Detroit, that people know for the tree plantings, they kind of picked it up, and they had the, what was it called? It was like the Detroit Agriculture Network to start with. It's changed names a bunch of different times. And then it was the Garden Resource Program. And so, historically, the neighborhood city halls is where you would go and pick up your seed packets or your starter plants or go do a workshop. So instead, the Garden Resource Program kind of filled that void, and they were doing the seed distributions and the workshops. And now that Garden Resource Program was able to spin off from Greening of Detroit and become Keep Growing Detroit. And they, part of what they do is they have the Grown in Detroit cooperative, which again is a group of their growers who they kind of aggregate their produce to have a farm stand. And they used to do this farm stand at Easter Market and a handful of the community markets. But again, because of the pandemic, this Shop Detroit Farms was a way to kind of shift the cooperative from being in person at farm stands to being online. And I know they used to do kind of a CSA model, but I think it's really hard to grow food. And it's really hard to kind of aggregate and have enough on a regular basis.
Thank you for answering that. And it looks like another question just came through the chat. Well,
Oh, that is a great question. I have not really dug into why. Yeah, I really don't know. And I'm not that familiar with their local models. If it's, well, I know a lot of them have been, no, I don't know. That's a really great question. That is one that I'd love to get down to the answer on, because it is kind of odd. Like, you would imagine pharmacy type activities are something that'd still be profitable.
Alex, I have a question related to Tracy's question. Did you do a food basket survey on any or in any dollar stores? I've never been in one. I despise them maybe as much as you. So I've never. Do they offer food, healthy food, or is it just chips and candy bars like?
Yeah, it's an interesting smattering. So usually they have, and even now. So when we started looking at dollar stores in like 2016, it was kind of hit or miss which ones had kind of foods and which ones had healthy foods. But that's when we started seeing, dollar stores had milk alternatives, and they had healthy low sodium soups, and then that became a whole kind of branding that they would push out to the community too. And now a lot of dollar stores, they have a grocery aisle. It's not very extensive, but and you can find, it's shelf stable food. So none of them are carrying fresh foods at all. Dollar General was working on a pilot of carrying fresh foods, but it wasn't in Detroit. It wasn't in Michigan or Detroit. I think it was like Tennessee. But because Dollar General often talks about how they are the local grocery store in a lot of rural areas. which is true. If you drive, north in Michigan, there's not really a grocery store. There's a Dollar General. So, hopefully that's something that changes and expands. I'm also, fingers crossed. I'm looking for CVS to do a little bit more now that they're owned by Aetna, the health insurer. I expect them to also have an extensive fresh food offering wherever they're located. Yes, thank you. Rebecca also noted a lot of the dollar stores do carry frozen fruits and vegetables, which is a great healthy alternative if you don't have the fresh.
Yeah,
and then it looks
we
like,
have a Q&A question. And
yeah,
Is that me?
June has a great question. Have I looked at correlation between health department inspections and enforcement actions in neighborhood grocery stores and those areas tending to go to suburban stores? Not with that question specifically. What we have looked at, part of what I helped found at the Detroit Food Policy Council, we now have, we call it the Detroit Grocery Coalition. So there's a handful of nonprofits and organizations that were working on engaging grocers in having healthier offerings and doing better with advertising and signage and whatever it might be. And one thing we've included is kind of a score for that store. So they get scored on the different elements of the NEMS survey. They get scored on their community perception, which is, we run the focus groups every other year to be able to get that scoring. And then we also score them on safety. And that's where the inspection data comes in. The really unfortunate thing with inspections is they're so poorly done in any kind of systematic way that we, a whole bunch of stores might be inspected one year, but not another year. So we've had to come up with this like 3-year average of, how often do you have a priority violation out of all of your violations? That's something, again, we're trying to push on MDARD. And I know before the pandemic, they had just done a hiring blitz because basically for all of Southeast Michigan, they had 2 inspectors, which is just an absurd amount of stores that they need to inspect on a regular basis. I can't even imagine. So I know they had hired a whole bunch of folks, but then the pandemic hit, so I don't know that they actually did that. I know there was, though, I want to say Dr. Kami Patakuchi at Wayne State in like 2006 or something looked at, or maybe it was either Kami or Dr. Raymond Mohammed at Wayne State. They looked at inspection data in grocery stores and how that kind of stacked up. That was a while ago, so maybe we should rerun the data. But it is just a really terribly messy data set that is not, the coverage is terrible.
Alex, do you have time for one more question?
Yeah.
For me, related to the shifting foodscape retail environment, what are your thoughts on the pandemic effects? Online shopping is now super popular. There's a fear of normalcy, sort of anecdotal evidence that people are afraid to go to stores and use mass transit. Do you think this current COVID, past or present, or even in the future, will affect or is affecting the foodscape in Detroit?
Yes, absolutely. And that's, I think the biggest impact we've seen in Detroit is food workers they're afraid to go to work. And so, we've seen a bunch of our stores, the owners are working double time to try to keep their store open and running, and they're trying to find people to staff it. But I think that's been the biggest impact. And I don't know Then we've also seen a lot of these grocers with COVID. They were like, all right, well, we were planning on closing in like 2 years, but we're closing now. We just can't do it anymore. So I know, right now there's probably 2 or 3 grocery stores that are for sale. Their owners are ready to be out of the business. And probably if no one buys, they're just going to close by the end of the year. And that's a huge, that's something that I've been trying to push the city government for probably close to a decade. A lot of other cities have, I always looked at places like Baltimore and Philly with their healthy food retail initiatives. The city had a facade improvement program for 5 years. I don't know that was worth it. Maybe like fix your facade and carry better fresh produce from local growers. I don't know. But it just, it wasn't enough. And so hopefully, we're going to have some kind of program like that to incentivize grocers to open up in Detroit neighborhoods where we're seeing all these closures. Because folks are just not going to, in the last 3 years, a whole bunch of these full line grocery stores have also gone up in flames. You can make your own assumptions about why that happened. But for a lot of folks, they're looking across the street. It's a senior high-rise apartment, and they're looking across the corner and saying, well, that's where I got my food. They're probably going to reopen. And it didn't hit those folks until the bulldozers came that they were not coming back. And that's I don't know, that was a lot of people who depended on one grocery store on the city's east side. And I don't know where they're going to go to buy their food now.
Yeah, I think of internet access. Like if you don't have access to the internet, you can't even order food online through Amazon or wherever, Meijer, Kroger.
Right.
So yeah, it's an area that should be looked into, I think, for sure, in terms of food access.
Yeah, definitely.
Well, we're at 1:00, 1:02 according to my clock. Does anyone have any other questions? I found this talk super interesting, naturally. We have one more question from Tracy.
Oh, yeah, folks have tried the food truck model for a really long time in Detroit. The Peaches and Greens store was probably best known. They got a lot of national media attention in like 2011, or actually earlier than that, because after the Great Recession, they said basically no one wanted to buy food from a truck in their neighborhood anymore. They don't really know what it was, but it was just it's like an immediate shift from people were interested in purchasing food to just nothing. And people have tried that here and there, but it's just a model that there was the Up South food truck on the city's east side. They just never really got up and going. Gleaners actually runs, they called it My Mobile Grocer, where they focus on SNAP users. But they really need a high density because they have a semi truck, and they really need a high density of people to purchase food to make it worthwhile. And then there was that Fresh Corner Cafe where the whole idea was it's a small mobile van and they're doing pop-up markets at schools and churches and business places. And that just, it didn't, it made more sense actually than a farmer's market. But in the end, it wasn't a business model that worked.
Alex, how can people get a hold of you? I can send everyone your email, or if you have a social media account, or if you want to put it in the chat, possibly.
Yeah, definitely. That's you can find me pretty much anywhere at Alex B. Hill. So I'm Alex B. Hill at wayne.edu or on Twitter, Facebook, LinkedIn.
Okay. Thank you very much, Alex. This was really
Thanks
great.
so much.
I think on behalf of the cluster and Office of Research, University of Michigan Flint, I think I can say we're really happy to have you today.
Yeah, thanks so much for having me. This was great.
Okay. Take care. I'll be in touch for sure.
Okay. Bye.
Thank you.